Welcome to the Medication in Child Care training. This is Module 1. As you go through this training, you will notice a green icon. It will open a window with information on the images used in this presentation. This presentation also gives you the option to view subtitles, pause, or replay the slide from the beginning. All slides within this presentation must be viewed in order for you to continue. This training provides information on administration of medication, with standards for parental consent. In partnership with the North Carolina Department of Health and Human Services, this training is being offered by the North Carolina Child Care Health and Safety Resource Center, a program of the University of North Carolina at Chapel Hill. It is intended to meet applicable NC child care rules. Those who satisfactorily complete the training will receive a certificate of completion for 2 contact hours. The university does not require this training. Completing this training does not qualify participants as certified medical or healthcare professionals, nor does it replace the need to consult a healthcare professional for guidance. Nothing in this training, including any and all contents, materials, or information provided as part of this training, is, or should be considered, or used as a substitute for medical advice, diagnosis, or treatment. Never disregard or avoid professional medical advice or delay in seeking it because of something you have read, heard, or seen as part of this training. Contact a child care health consultant for implementation guidance. This training will cover reasons medications are given in early care and education programs, types of medications typically given, procedures for receiving, storing, documenting, and disposing of medication, the 6 rights of medication administration, common medication errors and rule violations, how to prevent them from happening, and how to document errors if they occur. According to Caring for Our Children, administration of medicines is unavoidable as increasing numbers of children entering child care take medications. Safe medication administration in child care is extremely important, and training of caregivers is essential. A child may need medication to 1. Prevent illness. A person may take a medication daily to prevent the symptoms of a chronic allergy, or a child may need diaper cream to prevent a rash. 2. Relieve symptoms of illness or injury, such as using medicine to reduce pain after an injury or receiving an emergency medication for seizures, asthma, or diabetes. And 3. Control or treat other short-term or long-term health problems. Medication should be given at home by families if possible. However, sometimes children require doses of medication while in early care and education programs. Think about this scenario as if it were a child in your care. Thomas has been enrolled in your program since he was an infant. He is now 4 years old and will be starting school next year. He adores his teachers and friends in his class. His mother attends college and works half an hour away. Thomas was recently diagnosed with asthma. His mom brought in the medical action plan signed by his doctor, along with the prescribed asthma medication. Thomas needs this medication before he starts active play, and if he begins wheezing or is out of breath. Would you be willing to give Thomas his medication? Why or why not? If Thomas gets the medication he needs, it means his mom can continue working. He can stay in a familiar environment with his friends. And he can stay in early care and education, so he is better prepared for entering school. Most early care and education programs must comply with Title III of the Americans with Disabilities Act, also known as the ADA. The ADA prohibits discrimination of anyone with a disability or anyone presumed to have a disability. This law requires programs to make an individualized assessment of a child's needs, then make reasonable accommodations to serve the child and their family. This may include giving medications to children with health needs. There are some Title III exceptions for early care and education programs that are operated by religious entities such as churches, mosques, or synagogues. Please consult the ADA for more information. Before giving medication, staff should receive quality training and have an opportunity to practice the skills they will need. Because of the potential for errors, administering medication to children in early care and education settings can involve liability, even when carried out properly. Having trained staff, effective policies and procedures, and correct documentation will help early educators give medication efficiently and safely with minimal errors. The next several slides will cover North Carolina laws and child care rules for medication administration. For all types of medication, the child care program must have written authorization from the child's parent to give the medication. North Carolina child care rules define the word parent to mean a child's biological parent, legal guardian, or full-time custodian. Any medications given in child care must be given as directed by written instructions from a parent, physician, or other health professional. Must not be expired. Must not be given for non-medical reasons, such as to induce sleep. And must not be given if the child has a known allergy to any of the medication's ingredients. The requirements of North Carolina child care rules for written authorization for giving medication came into effect after a situation in North Carolina in 2001. 5-month-old Caitlin Shevlin was given an over-the-counter medication known to cause sleepiness while in an unlicensed child care arrangement. Caitlin died. Her death was ruled as sudden infant death syndrome. Her caretaker served 4 months in prison on misdemeanor charges of child abuse by reckless endangerment. In 2003, North Carolina lawmakers passed a law, named Caitlin's Law, making it a felony to give medication in both unlicensed and licensed child care facilities without written authorization by a parent. Despite these types of laws being present in many states, incidents of giving medication for non-medical reasons without parental consent still occur. Whether on purpose or by careless actions, serious harm may occur during medication administration. All medications that are in the center must have a matching authorization from a parent. The authorization is documented on a medication administration permission form. Sample forms are available on the North Carolina Child Care Health and Safety Resource Center's website and the DCDEE website. Other versions of permission forms may be used, but must contain all the information required by child care rules. All the fields on the form need to be filled out completely, and the form must be signed and dated. Medication administration permission forms must be retained the entire time a child is enrolled, and until 1 year after the child is no longer enrolled. Child care rules specify that records must be accessible during the hours of operation. These records may be in a paper or electronic format with required signatures. Permission for medications can be given for various lengths of time, depending on the type of medication. Medications fall into 2 categories: prescription medications and over-the-counter medications. Prescription medications are prescribed by a healthcare professional. Some examples are antibiotics, medications to prevent symptoms of chronic diseases like asthma, and emergency medications. Over-the-counter medications are available to purchase without a prescription. This may include medications to treat symptoms of short-term illnesses, topical antibiotic cream, and medication for intestinal disorders. North Carolina child care rules make a distinction between over-the-counter medications and other over-the-counter, non-medicated items that are applied to a child's skin, gums, or teeth. This includes ointments, repellents, lotions, creams, powders, sunscreen, and fluoridated toothpaste. These items fall under the same child care rules as other over-the-counter medications, but have different requirements for storage and documentation. Written authorization to administer a medication can last for varying amounts of time. It depends on the type of medication and why it is being given. After the authorized amount of time has passed, the permission form is no longer valid, and the medication may no longer be given unless a new form is completed and signed. No matter how long the initial permission form is valid, parents can withdraw permission at any time in writing. Authorization from the parent for prescription medications can last for the length of time the prescription is written to be given. For example, if a doctor prescribes an antibiotic to be taken for 10 days, the permission form can be valid for 10 days. Authorization for most over-the-counter medications, such as ibuprofen for pain from a broken arm, or topical antibiotic cream for abrasions, can last for 30 days. However, there are 4 exceptions to this 30-day rule. Situation 1. The medication is for a chronic medical condition or allergic reaction. If the condition or allergic reaction is written on the permission form, it can be valid for up to 6 months. Situation 2. The medication is a non-medicated item applied to a child's skin, gums, or teeth, including topical teething ointment or gel, insect repellents, ointments, lotions, creams, powders, or fluoridated toothpaste. These permission forms can be valid for up to 12 months. Or the medication is being given in 2 rare, very specific circumstances such as Situation 3. A single dose of acetaminophen, commonly known as Tylenol, can be given if the child has a fever and a parent cannot be reached. And Situation 4. During a public health emergency if directed by the North Carolina State Health Director, for example, for children living near nuclear facilities. In these 2 cases, the permission is valid for any length of time, or the permission form can include a statement that the permission is valid until withdrawn by the parent in writing. These details about permission validity do not need to be memorized, they are available on the medication administration poster as a reference. Anyone who receives medications from a parent to be given while the child is in care should have access to a poster as a quick reference. Any child with asthma, allergies, or other chronic health care needs who require specialized health services must also have a medical action plan. This is in addition to the permission form. Medical action plans may include the child's diagnoses, including dietary, environmental, and activity needs. Contact information for the healthcare professionals involved in the child's care. The medication the child takes on a scheduled and emergency basis. Signs and symptoms that indicate if a child needs emergency treatment. Instructions on what actions to take in case of an emergency. And any other necessary instructions for the care of the child. The plan must be on file upon enrollment or whenever the child has a new need or receives a new diagnosis. The plan must be updated at least annually, and whenever changes are made to the child's care by the parent or health care professional. Child care rules allow the medical action plan to be completed by the child's parent, legal guardian, or a health care provider. National best practice standards in caring for our children recommend that a child's primary care provider or specialist completes and signs the medical action plan. Sample medical action plans are available online at the North Carolina Child Care Health and Safety Resource Center website or DCDEE website, but other versions are acceptable, as long as they contain the information needed to safely provide routine and emergency care in child care programs. While child care rules require parental authorization to give medication, the rules do allow the administration of medication to a child without parental authorization if 3 conditions are all met. 1. It must be an emergency medical situation. 2. The child's parent is unavailable. And 3. The medication is administered with authorization and in accordance with instructions from a medical care provider. For example, North Carolina law allows early care and education programs to provide first aid for a child or adult without a known allergy who experiences anaphylaxis. This law allows health care providers to prescribe epinephrine auto-injectors in the name of the early care and education program. It also specifies that programs can acquire, stock, and administer epinephrine auto-injectors when a child or adult without a known allergy experiences anaphylaxis. To give epinephrine, early educators must have completed training on administering epinephrine and believe, in good faith, that a child or adult is experiencing anaphylaxis. For training or more information about stocking an epinephrine auto-injector for use in an emergency, contact your child care health consultant. Medication permission forms, medical action plans, and other documents that contain medical information necessary to provide care should be confidential, but easily accessible for early educators. Visitors and parents of other children should not be able to easily see this information in a classroom. Clearly labeled cover sheets are one way to keep information that is posted in the classroom accessible, but private. All medications must be accompanied by written instructions from the parent or health care professional. These instructions must specify the name of the child, the name of the medication, the amount of medication to give, and how frequently the medication is to be given. Written instructions should also include any additional information needed to give the medication safely. This includes any instructions on the child's preferences for taking the medication, whether the child has had a dose before, and any reactions or side effects to watch for. Prescription medications must be in the original pharmacy container with the pharmacy label attached. These labels include the child's name, instructions for giving the medication, the date the prescription and the medication expires, and name of the health professional who prescribed the medication. If the medication is to be given as needed, the specific criteria for when the medication should be given must be on the label, the permission form, and the medical action plan when a plan is used. Sometimes healthcare providers may give a pharmaceutical sample to a family to see if the medication is effective before having a prescription filled. Since the healthcare provider is providing the medication, it is like a prescription. But since there is no prescription label attached, written instructions, signed and dated by the healthcare provider, must be attached. Over-the-counter medications must be stored in the manufacturer's original packaging. If the medication came in a bottle or tube inside a box, both need to be labeled with the child's name and available as they may contain information about the medication. In addition to the container with the child's name, written instructions from the parent or healthcare professional must be kept with the medication and contain the child's name, the name of the authorized over-the-counter medication, the amount and frequency of the doses, and any other information necessary to give the medication safely. The written instructions must be signed by the parent and/or healthcare professional. According to North Carolina Child Care rules, the amount and frequency on the instructions cannot exceed the amount and frequency of the dosages on the manufacturer's label. Some over-the-counter medications contain instructions to ask a doctor under certain circumstances. In these situations, written instructions from a healthcare professional will be needed before giving the medications. For example, a parent may ask that a medication be given to their 1-year-old, but the manufacturer's label says for children under 2 years of age, ask a doctor. Or, a parent may ask that a cream be put on a child's rash for the next 2 weeks, but the label says do not use for more than 5 days unless directed by a doctor. In these situations, written instructions from a healthcare professional will be needed before the medication is given. Over-the-counter medications have one expiration date, which is the date the medication expires. Prescription medications may have 2 expiration dates, one for the prescription, which is 1 year from the date the healthcare provider wrote the prescription, and one for the medication itself. If the medication has expired, it cannot be used. If the prescription has expired, ask the parent to obtain a new prescription from their doctor before giving the medication. All medications and permission forms should be checked at least monthly. Note any that will expire soon and make the parent aware, so they can sign a new permission form, bring a new medication, or get a new prescription before it expires. Knowledge check time. How long are permissions for prescription medications valid? All medications are meant to be taken in one of 2 ways. On a scheduled basis, like antibiotics that are given every 6 hours for a certain number of days. Or, on an as-needed basis, like an anti-itch medication for itching. Medications that are given as needed have a minimum time to wait before giving more of the medication. In early care and education programs, the parent must specify in writing the times to give scheduled medication. For example, if an antibiotic must be given every 6 hours with food, and the parent gives a dose at 6 a.m., the next dose will be due at noon with lunch. The parent may write, "Give between 11:45 a.m. and 12:15 p.m. with food." Medications given on an as-needed basis must have written instructions about how often the dose may be given and specific signs and symptoms to look for to know that the dose is needed. For example, if Susie's skin is dry, irritated, or she has a rash, and she is scratching, apply this prescription ointment to the rash. Wait at least 6 hours before reapplying. Often pharmacy labels are missing the specific signs and symptoms to look for on the label and simply say as needed. This is because the doctor may have told the parents what signs and symptoms to look for during the office visit. In this case, the parent must provide those instructions in writing. That way early educators can also know what to look for. These instructions may be written on the permission form or medical action plan or both. For both scheduled and as-needed medications, ask when the child received the most recent dose. That way it's known when it is safe to give the next dose. At home, all types of medications can be given on a scheduled or as-needed basis. But in early care and education programs, this is not the case. North Carolina child care rules allow prescription medications to be given on a scheduled or on an as-needed basis. Over-the-counter medications can also be given on a scheduled basis. But over-the-counter medications cannot be given as needed except in certain situations. These are the same situations that allow permission forms to be valid for more than 30 days. Situation 1. The medication is for a chronic medical condition or allergic reaction. If the condition or allergic reaction is written on the permission form, it can be valid for up to 6 months. Situation 2. The medication is a non-medicated item applied to a child's skin, gums, or teeth, including topical teething ointment or gel, insect repellents, ointments, lotions, creams, powders, or fluoridated toothpaste. These permission forms can be valid for up to 12 months, or the medication is being given in 2 rare, very specific circumstances such as Situation 3. A single dose of acetaminophen, commonly known as Tylenol, can be given if the child has a fever and a parent cannot be reached. And, Situation 4, during a public health emergency if directed by the North Carolina State Health Director, for example, for children living near nuclear facilities. In these 2 cases, the permission is valid for any length of time, or the permission form can include a statement that the permission is valid until withdrawn by the parent in writing. Every early care and education program should have a policy in place that covers receiving, documenting, storing, and disposing of medication. A policy gives early educators a guide to know the procedures and practices they need to follow to administer medication. In this training we will cover each of these policy pieces. The North Carolina Child Care Health and Safety Resource Center has created a sample North Carolina medication administration policy for early care and education programs to use. The medication administration policy should specify who is responsible for receiving medications. The person responsible should check that there is written authorization from the child's parent. Written instructions for giving the medication are complete and easily understandable. And that any instructions match instructions given by pharmacy or manufacturer's label. Ask the parent if the child has received a dose of the medication before. It is best practice for children to have the first dose of any medication at home to check for adverse reactions or side effects. However, if the medication is for emergencies, the child may not yet have needed the medication. Be sure the medication is labeled properly and not expired. Being given for appropriate, medically necessary reasons. And that the medication needs to be given while the child is in care. Medications that are given 1 or 2 times a day should be given by the family, at home. Also be sure the child does not have an allergy to any ingredient in the medication. Some prescription medications are regulated by the federal government due to the potential for abuse. These are called controlled substances and include narcotic pain medication, some medications for ADHD, such as Ritalin or Adderall, and some seizure medications. The person receiving medication should always document the number of pills or doses of controlled medications with the parent when they are received. That way there can be no question of how much of the medication the parent delivered. Facilities should also limit access to the storage containers for these types of medications. When these medications are returned to the parent or disposed of, they should also be counted to note any discrepancies. Thomas's parent has requested that he be given 5 milliliters of this medication every day at noon. Is this request appropriate? It is not. According to the pharmacy label, the healthcare provider has instructed anyone giving the medication to give 2.5 milliliters once a day. The parent is asking for double the dose of the medication to be given while the child is in care. They are also asking early educators to give a medication that is only needed once per day, which can be done by the family at home. North Carolina child care rules state that when questions arise concerning whether any medication should be administered to a child, the early educator may decline to administer that medication without signed, written dosage instructions from a licensed physician or authorized health professional. Medications and candy can look very similar. This is dangerous when children or adults mistake one for the other. Look at the two pairs of images. One object in each set is candy and one is medication. Can you tell the difference? In the left image, image 1, of the gummy bears, A is the candy, and B is the medication. In this image the medications are vitamins. In the right image, image 2, of the circular objects, A is the candy, and B is the medication. These medications are decongestants. Rules for both child care centers and family child care homes require that medications must be stored in a way that keeps children safe. Medications must be stored in their original containers and according to instructions on the label. Read labels carefully for instructions to keep the medication at a certain temperature. Medications must also be kept separate from any toxic substances, separate from or below food, and in a clean locked container or cabinet. Keep a copy of the permission form and all written instructions with the medication. Combination locks, keypads, electronic or magnetic devices, and keyed locks are appropriate devices for storing medications and are required by sanitation rules for child care centers. The key or other device needed to unlock the cabinet or container must be kept out of the reach of children and not in the lock. There are two exceptions to child care rules requiring lock storage for medications. 1. Certain designated emergency medications. And 2. Over-the-counter, non-medical items labeled keep out of reach of children with no other warnings on the label. These may be stored unlocked when not in use, but must be inaccessible to children. However, items under pressure in an aerosol container must also be kept in locked storage according to sanitation rules for centers. This is important to remember for sunscreens or insect repellents. A better choice would be items in a pump spray that is not pressurized. In all early care and education programs, an exception to lock storage for medications is allowed for emergency medications. This exception applies to emergency medications that work very quickly, and where a delay of minutes in giving these medications could result in a serious, negative outcome. Examples are epinephrine auto-injectors for serious allergic reactions, diazepam for seizures, glucagon for diabetes, and rescue inhalers for asthma attacks. However, diphenhydramine, commonly called Benadryl, even though it may be listed on a medical action plan for allergies, is not a medication where a delay of minutes will cause a problem. This is because Benadryl and most other medications that are swallowed take 30 minutes to start to work. Medications like these must be kept locked. Emergency medications that start to work within only a few minutes should not be kept locked or in another area, but should be in the same location as the child who may need them, whether in the classroom, on the playground, or a field trip. Keeping these medications in an easily identifiable, wearable bag, near the exit to the playground makes it easier to remember to take outside. A red bag for medications and other medical supplies is a good choice. To keep the bag inaccessible to children, be sure the whole bag or other container is at least 5 feet above the floor or the ground when outside. Medication cannot be given after it has expired. The course of treatment is completed. If parental permission to give the medication has expired and is no longer valid, or if the parent withdraws permission, unused medications should be returned to the parent immediately. Child care rules require that any medication be returned to the parent within 72 hours. If the parent has not picked up the medication within 72 hours, it must be discarded. When medications leave the facility, document the details of when and how much of the medication was disposed of or returned to the parent. Follow any disposal instructions listed on the medication label and follow the recommendations of the U.S. Food and Drug Administration. Check to see if any medication take-back programs are available in the community. If no community take-back programs are available, remove medications from their original containers and put them in a sealable bag. Medications should then be mixed with an unappealing substance such as kitty litter or used coffee grounds. This mixture should be thrown into the outdoor trash where children do not have access. This is the end of Module 1. Continue on to additional activities and modules.